Hello. I am 1 week exactly post-op, and I thought it might be good to do a kind of like recovery diary, if for no other reason than just like document what's going on. So let's just see. Well, so the surgery was they took out my first rib and they took out my scalenes, my anterior and medial, and then they snipped my pectoralis, which is why I have this little tiny ice pack that needs recharging. But every time I cough or sneeze, it's like a knife is just getting plunged right here, so trying to like numb that. I have a patch on right now. It just arrived about an hour ago. It's scopolamine. I'm hardly on any opiates at all right now. Like, according to the bottle, I could be taking like 12 or 15 of them a day, and I'm taking, I don't know, 2 maybe a day. Yesterday I tried going like full metal, doing just ice packs and ibuprofen, and I was in just like such a world of hurt. And so I took an oxy last night, and I started just having waves of nausea. And I haven't been able to keep anything in my stomach. Been puking, been falling down. So the scopolamine has kicked in, and I was able to waddle down the stairs and come record this. So get the gory part out of the way. There's the incision. It's got a little bit of glue on it, and then there's actually a really surprisingly small amount of bruising. There's a little teeny bit of bruising like right here. You can't really see it that much. It's faded pretty quickly. But it's a shockingly small amount of bruising considering how they had to go in through something so small and do so much, but I'm not really going to think about that. The doctor did also, unsolicited, send me a picture of the rib, like as it was just like there on the table. If anybody wants a picture, I can send it to you. Really creepy, but I don't know, maybe it's just proof. Anyway, coming out of the anesthesia, the first thing that I noticed, I expected a lot of pain through here. There was no pain. Now I know it was like pumped full of painkillers, and I was also given, turn that off. I was also given a local block before general anesthesia, which was really kind of traumatic. I thought they were going to do that once I was under, but no, under ultrasound, they guided this giant needle in here and kind of numbed this whole quadrant. And it was just, it's hard to describe, but it was kind of like for the past 20 years, it's like there'd been a radio on with static, and it was just like that had just been turned off. So it wasn't even that the pain was gone, but this whole area just felt like immediately like ventilated. So I know we're only a week out, but I have a lot of hope for that. The incision actually doesn't really hurt. This hurts, and then the most immediate pain was my scapula, and it does feel like somebody's just trying to pull my arm off. Like, it's pretty painful, and that's kind of where the pain has gone for the past couple years. Like, I've had lots of arm symptoms and shooting pains and pins and needles, and I haven't really had much of that. I've had a little bit of, like, sensitivity, but they say that's normal. But the pain for the past couple of years has mostly been in my scapula, so when I woke up, I'm like, hello, old friend. So sometimes I'll put a lidocaine patch on that, sometimes ice, sometimes heat. It responds pretty well to the opioids. It doesn't go all the way away ever. I'm not willing to take the amount of opioids that would do that, especially because I guess I'm just so sensitive to them. Anyway, I have full range of motion, but it's slow. So like I don't feel really restricted anywhere. But excuse me, ooh, that coughing is hard. Don't advise that. That's not a lot of fun. This is the most I've spoken probably in a week. Anyway, so Anyway, so right now though, I'm just on like 2 opioids, kind of one in the morning, one at night. I've got this. Hopefully this is gonna help me be able to eat some more food. And apparently I should be starting physical therapy in a week. I haven't found somebody quite yet, but I've got a few calls out. But apparently the first couple weeks, it's not like the physical therapy that you think of. So it's not like I'm going to be doing, big time stretching or anything. It's mostly going to be like guided movement and just making sure that everything is kind of learning that the right muscles are moving the right parts. So we'll see how that goes. Trying to think, is there anything else that's like super relevant? I don't think for now. Anyway, so hopefully this time next week I'll be able to make another recording and I'll have a physical therapy appointment to report about. All right.